next episode of JASCHAT. I'm Jo.
I'm Sarah. How are you going?
I'm really well, thanks for asking, Sarah. How are you?
I'm very well, thank you.
Excellent. Well, today I want to talk a little bit about how they diagnose autism spectrum disorder. Because it's changed since I had Daniel diagnosed, so I was quite interested. Daniel was diagnosed under the DSM-4. It's now the DSM-5. So as I go through this...
Can I ask what that actually means? Because ours was 13 years ago, so we didn't have
It's a diagnostic and statistical manual of mental disorders.
Oh, okay.
So, but we'll go into that more
Okay.
Later in the piece.
So, yep.
But so basically there's no single test that can diagnose autism. As we know, all kids are different. So the diagnosis can be based on observing and watching how a child plays and interacts with others, interviewing their parents, and reviewing the child's developmental history.
Okay.
So, by using a combination of the tools, professionals can diagnose a child with ASD and determine where on the spectrum the child may fall.
So these days with diagnosis, is it a variety of specialists? So do you have like a speech therapist, a psychologist?
Yes.
Do they all have to sign off on it?
Not necessarily. I know that Daniel was diagnosed, the speech therapist said he has autism. You just have to go to the paediatrician.
Our paediatrician told us, but he said that we then had to go to the Monash Hospital to get a formal diagnosis. So he said straight away, yes, she's got autism, but now and I can start the ball rolling.
Yes.
But to get a formal diagnosis, you have to come to Monash and you have to have assessments.
And see, that was 16 years ago, I guess. Yeah. Now it's more, look, there's so much there. Monash would be like so busy.
Yeah.
So now it's more, we had the speech therapist, we had the paediatrician, and then just to finish it off, even though they knew he did, we went to see an OT.
Yeah.
So then you
pretty much do then, you have to have...
You do, but we already knew, it was just more...
a formality.
Yeah, formality.
Could I just touch on the subject of the parents' questionnaire?
Yes.
Because I know with this, it's not just for diagnosis, but it's also when you're going for aid funding for school or something. Please don't, as a parent, play down your child's behaviours. So if your child has only done something once, don't say, yeah, they probably don't do that, because that doesn't do your child any favours. If there are things on the checklist for a reason to see, even if, like Beth, for example, going for funding for primary school, she had cut a child's hair in kindergarten. So she's made out to sound like a monster for aid funding. It's unfortunately what you need to do. And all right, she had only done it once, but she had done it. So therefore you have to say she's a danger to others with scissors because of that. And that's the reality is that she was. Sounds horrible to say it, but you're not doing your child any favours by denying that. And
the worst possible scenario is possible.
Absolutely.
If they've done it once, they'll do it again, and it could be worse.
Yeah, absolutely.
So, Beth cutting somone's hair could have turned into Beth trying to cut someone's hair and stabbing them in the neck or something.
Let's just see what this happens.
Exactly. And only, you have to be totally honest with yourself. Sometimes it's gut-wrenching, but when you realise that it's going to be for your child's benefit and for your benefit.
If they're going to get the optimum that they need, especially when it is safety, but with anything, then you need to be honest about it.
Absolutely. And most people will go, oh look, we do have to write down the most difficult things for you. And it's like, well, you've got to do it.
Yeah.
Just got to take a deep breath and let people do it.
Yeah,
because
absolutely. And they don't like doing it. Professionals don't like doing it, and they will say to you, our principal has said, so sorry that we have to write this down, but to get the maximum funding, that's what we need to do. And it's unfortunate, but it's just the way it works.
And I just say, look, go ahead.
Yeah.
Because if it means Daniel's going to get the help he needs, I'm all for it.
Yeah.
So I'm not saying, lie.
Anyway, that's about aid funding.
Yeah, that's about aid funding.
Let's go back onto the diagnosis.
We've got so many things to talk about, but so little time. So from the, here's a quote from, I think it's Shauna Smith. She's a mother of 4 and the co-author of the Australian Autism Handbook. Most people find the diagnosis process quite confronting. It's not much fun having someone point out all the things that your child can't do, things that typical children just pick up naturally. But think of this assessment as a benchmark against which you can measure your child's progress once they start an intervention program. So, you need to start somewhere.
True. Yeah. And I do. I look back on things with Beth, especially if we're having a bad day, and I think to myself, gee, she's come a long way, and that's what you've got to think of. This is the beginning, and it is the vile years. If your child hasn't even started school yet, it's a horrible time.
Yes.
But they do get better.
Better, because I remember the first show. Yes, they improve.
I don't mean they get better.
They don't get. There's no cure.
No,
but yes, they do improve, and they become more complete and more well-rounded. I think about Daniel too, and at school I go to the student support meetings, and I'm like, anything new's a bonus, because I never thought he'd be doing half the things he's doing now.
Absolutely. And I think anyway, it doesn't matter, that's not to do with diagnosis, so let's go back onto diagnosis.
Okay.
Because we keep talking about school.
Yes, I know, school's just so exciting. Okay, so the professionals who can diagnose autism spectrum disorder, which we've already covered, are paediatricians, psychiatrists, psychologists, occupational therapist, a speech pathologist. That pretty much covers it. I can't think of any other professions that can do that or will do it. So once your child receives the diagnosis, you need to find out about their eligibility for support. And again, we'll touch on that in the future program. Now, nothing's stopping you from getting a second opinion if you disagree with the people that have diagnosed your child. So don't ever take anyone's opinion as it, complete, end of story. If you want to, go and seek a second opinion. So now, my son was diagnosed under the DSM-4. The changes for the DSM-5 aren't massive. It means that everybody's under the one umbrella now, be it Asperger's, PDD, NOS, autism. Okay. And they're all graded from 1 to 3 now. So the DSM-5 replaces the old manual. So it's a new single diagnosis. And
what is the diagnosis called now then?
It's ASD.
Okay.
But it's a 1, 2 or 3.
Right.
So the single diagnosis replaces the subdivisions of autistic disorder, Asperger's disorder, and pervasive developmental disorder not otherwise specified, which is one of my favourites.
PDD,
I love it.
Do you?
I
think it's the one that they don't know what your child is. So
yes,
I'll shove you in that category.
But I love the fact that there's this massive title for a disorder. It's just brilliant. There must have been something better. But anyway.
Well, it's gone now anyway.
I love it. Yes, well that's right. It's either level 1, 2 or 3.
Yeah.
So now there's a severity ranking of level 1, 2 or 3. So the ranking depends on how much support the person needs. So this will reflect whether or not their symptoms are mild or severe. So it's based on 2 areas now. A child will need to have difficulties in both areas to be diagnosed with ASD. This approach replaces the previous 3, which is social interaction, language and communication, and repetitive and restricted behaviour and interests. So now it's social and communication problems have been merged into deficits in social communication.
Okay.
And difficulties in this area include rarely using language to communicate with other people, not speaking at all, or not responding when spoken to, or not copying people's actions. The second area is fixated interests and repetitive behaviour. So examples of this would be the lining up of toys, or having very narrow or intense interests.
Obsessions almost.
Yes, and then sensory activities, which were not in the DSM-4, are now in the 5, and they're included in the fixated interests and repetitive behaviour, because it is repetitive, not liking labels on clothes, eating only foods of certain colours or textures.
Yeah.
So they are things that will be considered when you are getting the diagnosis. Children who already have the diagnosis, they don't need to do anything, they can just keep using the terms that they want to. So people are still going to have Asperger's. It doesn't stop you from having Asperger's. No. You're not going to go, I'm ASD category 1 or ASD category 3.
I've got PDD.
Yeah. Because I love to say it. So, it's interesting because, well, you didn't even have the DSM.
No.
And I've got the DSM.
We were lucky though that our doctor said, sounds like she's got autism. Went to the paediatrician. I said, Jeff thinks she's got autism. They said, yep, we do too. Now it's just a formality. So it's much easier, whereas a lot of people I've heard nightmares about getting a diagnosis for their kids because it seems to be the trendy thing to do these days.
Well,
so a lot of specialists say, oh God, don't tell me you think it as well. You know, like a lot of, and there are the genuine ones and then there are the not genuine ones, and I know both. And it's very difficult for the genuine ones because they know there's something wrong with their child and they can't get a diagnosis.
Yes.
And it's very frustrating when you know people that aren't genuine, that know what the right answers are to the questions to get a diagnosis for their child, and then get them and you just think, you've got nothing wrong with your kid. And I know we don't all know what the, what other people's kids are like in the home, but there are just, I know that there are parents that do that as well.
Absolutely. Yeah. I've noticed them too.
Asking lots of questions so that they'll find out what the right answers are.
Yeah, and it's just the tiniest. Exactly, that's right. But, you worries about...
Not that I'm saying why would you want this, as in why would you want a child like that?
Because sometimes in the early days, a diagnosis would mean that you can access speech therapy and OT with the helping children with autism.
See, we didn't even have that.
Yes, so you have
none.
Yeah. Whereas now it's autism is the new black.
Yes, it is. Because they're just so bloody apes.
They are, and a lot of the holy people that needed solitary confinement, they say were autistic because they could go up into the mountains and just be there by themselves for...
Yeah, they used to be revered.
Yes.
Yeah.
Exactly.
I think that they need to be again. I think it's our job to make sure that they are.
That's right, exactly. They really are, yes. But again, we'll get to... You'll discover that anyway if you haven't already discovered. Just one more thing. There are some kids that have a diagnosis of 2 or more disorders. So you could have ASD along with ADHD. So, or ODD, which is oppositional defiance disorder.
There's another one above that as well. I can't remember what it's called, but there is another one.
There's all sorts of disorders.
Yeah. Conduct disorder. That's the next step up.
Oh, yeah. Okay. So that's is that when you're sent to a behavioural...
Sometimes they're sent to a behavioural
centre.
But it's, it's horrible. It's horrible. Makes me appreciate how easy my Beth is in some ways when I've seen kids that have got these behavioural problems and can be quite violent with it. And
yes.
Yeah.
But
anyway,
that's we'll discuss those issues another time. But so that is, in a nutshell, a very small nutshell, a diagnosis and how the diagnosis is different to the DSM-4, which I found very interesting when I was researching this. And you probably It was eye-opening.
I don't know.
Yeah.
I don't know anything about it. So.
Seems you learn something new every day. Just when you think you
know
know everything.
that's just going to go right out of my head.
No, you'll be going DSM-5 says blah, blah, blah. Don't worry, she will. So thank you everybody for joining us today.
Thanks again.
And we'll see you at our next show.
Make sure you pass on to all your friends who we are and what we do.
And happy jazz chatting.
Bye.
Bye.